Action for your health right now. Experts taking your calls and online questions about weight loss and obesity. Lizette Campos is live in our phone bank. Lizette.
Hi, everybody. It has been extremely busy. We have experts from Florida Surgical Weight Loss Center and Memorial Hospital of Tampa working the phone banks. The topic, as we said, is weight loss, obesity, and different treatment options. The phone number to call is 1-888-209-8881. We will be here taking your calls until 1 p.m. You're looking at a live shot of Nurse Erica Strife, and take a look. In her hand, she's got a phone, and she's Googling the app for BMI. So when folks are calling and trying to determine what their body mass index is and whether or not they are medically obese, she helps them calculate that. They've got all the answers. Really, they're talking to folks, asking a variety of questions. Some folks are not really sure if they're obese. Other folks are calling in and saying, I've been told I'm obese. And this is a term that's used loosely. These doctors are explaining exactly how they determine that medically, and that's important because then they can determine a better course of treatment. Dr. Richard DeChico just got the phone. He is going to put the viewer on hold for a second. Dr. DeChico, the options, a lot of folks are asking about the surgical options that exist nowadays.
Great question. Yeah, nowadays there's three main surgical types that are being done. There's lap band, least invasive. There's the gastric bypass, the more invasive, and the gastric sleeve surgery, which is intermediate. With the lap band surgery, we simply wrap a silicone band around the upper portion of the stomach. With a gastric bypass, we don't remove any part of your GI tract, but we actually do divide the stomach, separate it, and divide part of your intestine and connect them again. So there's a bypass segment. So you have restricted amounts of food you can eat, but also a malabsorptive segment. Plus also with the sleeve, we physically remove about 75 to 80% of your stomach.
We will continue the conversation after the break. Stay tuned, folks. They are answering your questions until 1 o'clock. The number to call is 1-888-209-8881.